It's not on live yet. Okay.
Okay. Will you let me know when it is?
Yeah, it's loading right now.
Okay. And Pi, you know how to find it?
Now
I
it
just got
is.
there. Yeah, there.
Okay, thank you. Okay. Tiffany, are we all set?
Yes.
Good morning. My name is Lisa Brody, and I'm the team leader for the St. Petersburg office of Bay Area Legal Services.
Hello, my name is Tiffany Coleman, and I'm the staff attorney for the St. Petersburg office of Bay Area Legal Services. I work primarily with the Medical Legal Partnership in partnership with Community Health Centers of Pinellas that is funded by the Foundation for a Healthy St. Pete.
We are also joined by attorney Pi Young, who also works in our St. Petersburg office, and she's going to be assisting us with any questions that we have today as well. So again, thank you for joining us for our Facebook Live that will address COVID-19 and the impact that it has had on communities of color, specifically across the country, but right now we are going to be talking about our local community. This Facebook Live is the 6th in a series of Facebook Live presentations that Bay Area has been presenting in order to provide legal education and information to our clients during this health pandemic. Topics have included evictions, mortgages and foreclosure, veterans benefits, domestic violence, and relative caregiver information. Please visit our Bay Area Legal Services Facebook page to revisit any of those topics that may be of further assistance to you. A few more housekeeping issues before we get started this morning. Please place any questions that you have in the comments section on Facebook, and we will do our best to answer those questions this morning. Also, the contact information for Bay Area Legal Services is 1-800-625-2257. Again, the contact information for Bay Area Legal Services is 1-800-625-2257. Before we begin our discussion today, I would be remiss if I did not recognize the tragic death of Mr. George Floyd that has led to a much larger movement and discussion about issues of race, equity, and social justice within our country and our local communities. For over 53 years, Bay Area Legal Services has been committed to providing access to justice for our low-income and marginalized communities here in the Tampa Bay area. This Facebook Live was actually planned several weeks ago as part of the work that Bay Area is committed to doing within our community to address issues of health and social disparities with our ongoing work that through our medical legal partnerships, with the Bay Pines VA Health System and the Community Health Centers of Pinellas, Johnny Ruth Clark location. We recognize that social and health disparities do have an impact, not only on our clients' health incomes, but on our clients' ability to maintain stable, safe, affordable housing and access to economic stability. We hope that our record stands for itself, but we also realize that there is much more work that we can do in the area of equal justice and access to justice. Our work centered around COVID-19 and the impact on communities of color is only the beginning of our continued commitment to being advocates for justice for those individuals and families and communities that are most in need. If you or someone you know is at risk of being evicted or losing their housing, still struggling with the challenges of securing unemployment benefits, finding yourself trapped and alone as a victim of domestic violence, or maybe a veteran trying to navigate receiving veterans benefits or any of the other areas of law that we cover, please contact Bay Area Legal Services for screening and eligibility determination. Our services are free for those clients who are income eligible for our services. So why this topic and why now? As legal advocates, in order to address health and social disparities, it is important to understand the cause of many of those disparities and the role that social determinants of health play in the health and the economic conditions of communities. The effects of COVID-19 on the racial and ethnic minority groups is still emerging. However, current data suggests a disproportionate impact of burden of illness and death among people of color. Here in Pinellas County, based on the most recent reports, 20% of the reported cases of positive COVID-19 are African Americans. However, African Americans are only 10% of the Pinellas County population. These startling numbers are mirrored across the country in communities of color. Why? Because where people live, where people learn, work, and play contributes to our health. Today, we are going to look at two specific areas that play an important role in these disparities, and that is housing and economic stability. And these are two of the areas that for us have really emerged during the COVID-19 pandemic. For communities of color, housing and living conditions may contribute to underlying health conditions that result in health and social disparities. From early redlining practices that restricted African Americans' access to lending and loans, to the return of our African American veterans of color from World War II not being eligible for VA home loans. Communities of color have not been afforded the same opportunities to pursue housing loans and financing. Systemic barriers to housing has also been one of the greatest areas of impact on communities of color because of the negative impact it has had on African Americans' ability to achieve generational wealth. These barriers and other institutionalized policies resulted in many of the housing conditions and circumstances that is a reality for so many today. As a result, we can see how the following contributors to health disparities have impacted communities of color, especially right now during the COVID-19 pandemic. Communities of color tend to live in more densely populated areas. As a result of years of institutional and systemic racism in the form of housing segregation, individuals and families living in densely populated areas find it much more difficult to practice social distancing and other preventative measures. Also, multi-generational households. Many communities of color, individuals who live within communities of color live within multi-generational households. As a result of access to housing again and the laws and policies that contributed to communities of color not being able to accumulate generational wealth, multi-generational households are more common in communities of color, which may find it difficult to take precautions to protect older family members, who are one of our most vulnerable populations during COVID-19, as well as finding it more difficult to isolate any of our family members that might be sick during this time or test positive for COVID-19. So Tiffany, can you also tell us a little bit more about how access to healthcare and the role that essential workers play as well?
Thank you, Lisa. People of color face challenges in having access to medical care. When received, it may not be equivalent to other groups of people. The challenges may be inability to pay, lack of coverage, shortage of healthcare providers in that area, cultural insensitivities, and discrimination. These challenges led to unmet healthcare needs, delays in appropriate care, inability to get preventative services, financial burdens, and preventable hospitalizations. In addition, people of color are the front lines of this pandemic. Doctors, nurses, and firefighters are not the only essential workers. There are janitors, home health aides, social workers, grocery store employees, fast food workers, and package handlers. Essential workers are overwhelmingly people of color who must stay in their jobs with a greater risk of exposure. Those who are working in high-risk conditions without proper protective equipment, safety standards, or workplace protections, and with low pay and a few benefits. The pandemic lays bare underlying structural inequalities facing communities of color that excluded them from opportunities and sticks them in low-wage occupations that ultimately expose them at a higher risk.
So this brings us to recognizing these social disparities of health. This brings us to the importance of legal assistance, education, and intervention so that we as legal advocates can begin to address these health disparities. At Bay Area, we are available to provide legal assistance and education to reduce health and social disparities. We provide free civil legal assistance for income eligible clients in the areas, again, of housing, financial stability, family law, consumer law, and veterans issues. Additionally, we have special programs that focus on the needs of our seniors, veterans, fair housing, and our medical legal partnerships, for which we are highlighting here today during this Facebook Live. So Tiffany, since you're one of our attorneys who specializes in the areas of addressing health disparities, can you please take a moment to tell us a little bit more about the work that you do, specifically through our medical legal partnership with Community Health Centers of Pinellas at Johnny Ruth Clark Health Center, as part of a special grant that we have received from the Foundation for a Healthy St. Petersburg?
Thank you, Lisa. First, I want to define what a medical legal partnership is. A medical legal partnership is a way to lessen the impact of the social determinants of health. A medical legal partnership places lawyers in healthcare settings so that the clinical staff can refer patients directly for legal services. My team works together to address medical, social, and legal problems that have an impact on overall health. An example would be a patient who has asthma and lives in a mold or cockroach infested apartment and has no resources to move, and the landlord refuses to clean or exterminate the bugs. A doctor would then refer the patient to the attorney, which would be me, on site to resolve such problem. The medical legal partnership recognizes social determinants of health and foster a collaboration between attorneys and healthcare providers. As we've seen in the most recent slide, we have the social determinants of health. The social determinants of health are conditions in the environment that affect a wide range of health outcomes and risk. It includes unstable housing, housing conditions, food insecurity, education, employment, and access to healthcare. All those things and more can affect the health of communities of color. When we're looking at social determinants of health, we're also looking at health disparities. And health disparities is defined as a difference in which the disadvantaged social groups who have persistently experienced social disadvantage or discrimination systematically experience worse health or greater health risks than the more advantaged social groups. Black people have higher rates of diabetes, hypertension, and heart disease than any other group. All risk factors for worse outcomes for COVID-19. There are startling and disproportionate death rates among Black Americans around the country from COVID-19 that reveal the already existing disparities.
Thank you, Tiffany, for that overview. At this time, we want to provide some legal information regarding the two areas that we highlighted today, which are housing and employment, because they're the two areas that have really emerged to the top in some of our medical legal partnership work that we're doing. So with many households experiencing a loss of income as a result of COVID-19, the topic of evictions is certainly at the forefront for many. Please note that the governor has extended the eviction moratorium for private landlord-tenant actions until June 30, 2020. So what exactly does this mean? This means that you cannot be evicted for non-payment of rent until after the moratorium expires. However, we are aware that filings of evictions have been taking place within the Tampa Bay area. If you have been served with a complaint for eviction for non-payment of rent during the moratorium, it is important to contact an attorney for legal assistance. This morning, we'd like to provide a few tips and reminders regarding evictions during COVID-19 and the moratorium. First, the moratorium did not remove the obligation to pay rent. Rent is still due. Again, the moratorium did not remove the obligation to pay rent. Rent is still due. So if you are able to, please try and pay your rent. Also, please contact your landlord to see if your landlord would be willing to enter into a repayment agreement. Many landlords do not want to lose otherwise good tenants who have come across hard times as a result of COVID-19. If you do contact your landlord for a repayment agreement, we would strongly encourage you to make sure you have that financial agreement in writing. Also, please seek financial assistance if you are eligible. There is financial assistance available throughout the Tampa Bay area, specifically for rent, mortgages, and utility assistance. Please contact your local 211 to find out more information regarding the financial assistance that is presently available in both Hillsborough and Pinellas County. Also, the governor's moratorium covers private landlord-tenant relationships. We understand and recognize that many of our clients live in public and federally subsidized housing. Federally subsidized housing and public housing is actually covered by the Federal CARES Act. Individuals who live in public and federally subsidized housing, the CARES Act provides for a moratorium on evictions through July 2020. Also, if you live in public or federally subsidized housing, it is imperative that you contact your local housing authority to seek a rent adjustment if you have experienced a change in your income or a loss in income. We are able to assist clients who are income eligible for our services, and we would encourage you again to contact us. Tiffany, can you provide some information about the unemployment benefits?
Yes, thank you, Lisa. People of color are more likely to be unemployed due to the impacts of the pandemic on the labor markets. The general eligibility for unemployment benefits are losing your job through no fault of your own, meaning that you cannot have quit for personal reasons or fired for misconduct. You must be totally or partially unemployed. Your past earnings must meet certain minimum thresholds, and you must be able to work, and actively seeking work. There are additional benefits that are available to address COVID-19. You can get these benefits if you are laid off or your hours are cut or you are unable or unavailable to work because of COVID-19. You can get benefits even if self-employed, an independent contractor, a freelancer, a part-time worker, or don't have a work history long enough to usually qualify. You can get an additional $600 weekly through July 31st and up to additional 13 weeks of benefits. You can apply online at floridajobs.org or fill out a paper application and mail it in. If you are denied unemployment, you must file an appeal within 20 days. You can call Bay Area Legal Services for help and possible representation in your appeal. The Bay Area Legal Aid line is 1-800-625-2257. Again, 1-800-625-2257.
Thank you. We hope that we were able to increase your awareness regarding the impact of COVID-19 on communities of color and provide you with some legal guidance and tips that will help you not only the next several weeks, but over the next several months as we all continue to navigate these uncertain times. If you would like more information regarding housing and evictions, or any of the areas of law that we have covered previously in any of our Facebook Live series, please access the Bay Area Legal Services Facebook page. At Bay Area Legal Services, we believe that empowering our clients and community that we serve with legal education is critical in our role as we all seek access to justice. If you are experiencing a civil legal issue that Bay Area Legal Services can assist you with, again, please contact our legal aid line. Our services are free for income eligible clients. Pi, are there any other questions at this time?
Yes, Lisa, we have two questions. First, one viewer would like to know, what areas does Bay Area Legal Services serve?
What area? Okay, well, Bay Area serves the Tampa Bay region. So we have offices that serve Pinellas, Hillsborough, Pasco, Manatee, and Sarasota counties. And all of those areas, we primarily focus on areas that provide housing instability to our low-income community and other marginalized communities. So we do housing work, family law work, we do consumer work. We also have children's work as well, children's legal issues. And then we also have special programs, again, that focus specifically on our seniors, our veterans. We have a very active fair housing team, as well as our medical legal partnerships.
Okay, thank you. I also have a question here. If someone is being threatened by their landlord to be evicted because they or someone in their family has been diagnosed with COVID-19, Is that something that you guys would be able to assist with?
Certainly, that is something that we would be able to assist, and we would strongly encourage those individuals to reach out to us again at 1-800-625-2257, because there are other aspects of that that go beyond just the issue of traditional landlord-tenant. There potentially could also be some fair housing implications in there as well. So that's why it's important that we get this information out in the community, because we realize that there are probably people being threatened for eviction. And we realize that because of the loss of income that so many of our clients are experiencing right now, that many of our clients might be are presently probably being put in very uncomfortable positions when it comes to their relationship with their landlord. So we are prepared to be advocates for as many of those individuals and families as we can, because we realize that housing stability and certainly affordable housing in the Tampa Bay area is very important. And we want to make sure that our client communities can maintain their housing during this time and afterwards.
Just have one more question coming in. Can you speak on any issues that you address with the Bay Area concerning seniors specifically? Do you have any legal services that you offer to seniors specifically?
Well, seniors experience many of the same problems that all of our clients experience, problems in the area of housing. But here in Florida particularly, we notice that our seniors have a very high number of consumer cases that are seniors, because often with other, especially when you start dealing with special populations, our seniors become vulnerable to particularly consumer issues and potential scams that are out there that specifically target our seniors. So we address all of our traditional areas of civil legal assistance for our seniors, but we have a special team, and we have actually a senior legal aid line that specifically works and addresses, researches, and focuses specifically on the needs of our seniors.
Okay, so how would the seniors access that? Do they call the same number, or is there a different number that they would access those services?
They can access us through our Bay Area legal aid line,
Help,
and we also have a senior legal helpline, and we can make that number available as well. But if they contact us through our centralized telephone intake, which is the 1-800 number that we've been using today, they could be referred to our senior legal helpline, but we can provide that information as well. But again, I would like to emphasize that we do have a specialized team that works specifically with seniors.
Yes.
Thank you very much. I think that concludes the questions that have been submitted thus far.
Okay, so again, on behalf of Tiffany and Pi and myself and all of us at Bay Area Legal Services, I would like to thank you for joining us today. If you have any additional questions regarding how legal assistance, education, and intervention can specifically address social and health disparities, or would just like more information regarding Bay Area Legal Services and the services that we do provide, please feel free to reach out to us. We are here to serve our community and create pathways to justice. So again, thank you for joining us this morning for this conversation, and we look forward to serving you as we continue as a community to move through this COVID-19 health pandemic. Thank you.
Thank you.